So we'll go through the equipment used in a SAG or splint. Included will be the splint itself with the thigh strap. It'll have two ankle harnesses, one with a left and a right included. It'll also have two leg straps, one for the upper leg and the lower leg to secure the splint in place. So this traction splint can be used on an isolated femur fracture, or it can be used on a bilateral femur fracture if needed. So we'll go through the application of a SAG or splint, which is used in trauma for a mid-shaft femur fracture. The patient is supine. We're holding traction on the injured leg. We're going to feel for distal pulses pre and post splinting. So we have good pedal pulses. Sam is holding good traction. So we're going to take our SAG or splint. We're going to position it to the injured leg. And we're going to come in just up underneath here towards the thigh, inner portion of the thigh. And we're going to wrap our thigh strap underneath the patient's injured leg. And we'll lightly just secure this top portion. We won't tighten it as of yet. Just put it into place. Good. From there, we're going to attach the ankle harness. This will come in a right ankle harness and a left. So make sure that you use the appropriate one. You can also use this SAG or splint for bilateral femur fractures. So you can actually use the left and the right harness at the same time. So we'll put the left harness on while Sam is still holding traction. We'll secure this harness. And then we'll put our just put our straps in place for now underneath the patient's injured leg. So one will go just below the knee. And the larger strap will go just above. And this is for after the SAG or splint is in place, we can secure it. So I'm going to come around Sam, and we're going to attach the ankle harness and tighten it to the end portion of the SAG or splint right here. We'll loop that in. We'll pull that tight. And then from here, I'm going to hold into the plastic, the cushion part of the splint, and I'm going to apply traction to this injured leg. To your desired set point. The amount of traction that you put on this leg is for an isolated femur fracture is usually 10% of the patient's weight, up to 7 kg or 14 pounds or 15 pounds. And for bilateral femur fractures, you can put as much tension as up to 15 kg or 30 pounds is the maximum. So from there, we have that set. We again check for distal pulses, which are still there. And then from here, I'm going to tighten up the thigh strap, attach the large leg cravat, and attach the bottom strap. And this patient's ready for transport.